Scott County, providing safe, healthy, and livable communities.
One, to receive information on Scott County topic delivers drug-free communities. Chris Harder, you have that.
Good morning, Mr. Chairman, Commissioners. Thank you very much for some time on your calendar this morning. We're here today with a group of county and community leaders to talk about efforts to prevent access to substances, particularly among our youth. And the focus of our conversation today really is around prevention. This same group was here about 2 years ago. We have some data from our Minnesota student survey and from our resident survey that reflects on this. And so we have a nice collection of folks that are going to talk about our efforts to prevent access and to prevent the use of chemicals in our communities. So with that, I'll ask the folks on this side of the table to introduce themselves, then ask our panelists to just say who you are and what your role is, and then we'll get started with the questions. I do want to say there is just a person or two that we're waiting for, so folks may join us. So Cindy, will you start?
You bet. Good morning, Commissioners. My name is Cindy Geis, and I'm the Community Services Director.
Good morning. My name is Jennifer Schultz, and I'm the Enterprise Risk Manager.
Good morning. My name is Steve Jones, and I'm in the Office of Management and Budget.
I'm the Public Health Director.
Sergeant Dvorak from the Scott County Sheriff's Office.
Pastor Karen Treat from Shepherd Lake.
Gina Erickson, I'm the data planner in public health.
Amy Carlson, I'm the
So I would ask the folks on that side of the table, if you'll just hit the round buttons on your microphones to turn those on, please. Thank you.
And I believe Tana Sievertson is almost on the call or will be on the call shortly.
Thank you. All right. Jennifer, will you want to start us out?
Absolutely. Good morning. First of all, I just want to say, as I was reading through this packet, and just clearly the focus on prevention, thank you. It's tough work, and you guys are doing a great job. One of the things that stood out to me as I was reading through the introduction, and particularly around the comments about what's not working, I couldn't help but think a little bit about some of the new legislation that's gone through, particularly around the THC edibles. And so just kind of a broad question to anybody on the panel. I'm not really directing this in anyone in particular, but how does that really impact that legislation? How does that impact your work? And what are some steps that your group envisions kind of taking? And because I believe there probably is going to be some impact on the work that you're doing based on that legislation. So again, just kind of a broad question.
I can probably start the answer to that. I actually have had the opportunity to read the new 300-page modification to the edible law, which was quite deficient previously. There are still quite many gaps in the legislation, particularly where no money is coming to the local counties. All the money is going to the state, but there's going to be a huge burden to the county and locals related to enforcement and response. One of our particular issues, education on edibles doesn't start for about 3 years in, so we're going to roll out all these products into the community and not do any youth education, so it'll be a catch-up by then. Another big piece is they're going to do some studies, but one of the things they did not include is poisonings of children, which we already are seeing an increase, and I actually brought some visuals today to show you part of our concerns. These are gummies, and this looks exactly like my Hall's cough drops. Like if I had them side by side, I couldn't tell the difference. This one here, and keep in mind they're not supposed to be marketing to kids, but there's a little face thing on there. This looks almost exactly like those squeezy applesauces. Hardly can tell the difference on that one. And then this one looks exactly like children's vitamins. Now these are all being sold and are considered legal, all being sold right now throughout the state with very little enforcement. So enforcement is going to fall on the locals. We went to a variety of different places that will be able to sell. There was no education for trainers. So it really is going to be, it's almost a free-for-all right now. We have a lot of concerns related to youth access and education. Do you want to add anything, Jamie?
I think one of the important things that we'll be focusing on too is just educating on the potency. It's not like the edibles or the weed that was back in the 90s that we have available now. These potency limits are way higher than what they were, and the majority of people don't know that. So a lot of education to the community on locking up those edibles, any kind of substances that they have available in their home, making sure their kids don't get a hold of those products will be very important as well.
Thank you.
Do you want to mention anything about law enforcement perspective?
One of the things that law enforcement's often faced with is that when new products come to the field, it's just going to increase the likelihood that someone else is going to get it that shouldn't have access to it. So if you take the problem that we have with alcohol and alcohol compliance, we've just doubled that because we now have another product that is viewed by many to be similar to alcohol. But just like alcohol, we know that it has severe ramifications for children or people that should not take those certain substances. So one of the things that the Sheriff's Office is always looking at is opportunities to network with other resources that might be able to provide another tool for our tool belt, if you will. And one way of doing that is working through public health. One thing that our Sheriff administration has worked quite strongly on each year is that there are 2 or 3 months at the beginning of each year where the Sheriff's Office is broken up into 2 teams where they're able to have training. And one week, Team A is being trained, next week, Team B is being trained, and this is where public health can come in and talk with us so that we're starting to network. We have an understanding of what the problem is, and we can come together for a solution and then act upon that. Education is key, but we know that ever since I've been in high school, which is now a long time, alcohol issues are not going to go away. So this is going to compound it, but we do the best that we can based on the resources that we have in line with our authority, and we simply move forward.
One other thing I want to add is you have to be 21 to purchase these products, but that was the same that happened with vaping, and we know how well that worked. When we did go around at stores, we did go to one of the stores, Jordan store actually, that's already set up. They're they don't want to sell to minors. They also want a way to work with the county to provide that education to identify those gaps, and they're very happy to provide us some education and information that they think where we can partner together to keep it out of the hands of kids. So it really isn't an adversarial relationship that we've discovered so far, and we are looking forward to working with the distributors and the marketing so people don't have access, and it's safe for kids. The other piece that is also a public health issue falls under the nuisance law, but I was very happy to see that they added in there that people are not allowed to cook at home because you use solvents that tend to blow up, and we appreciate people not blowing up their homes in the county. So,
Thank you.
Going along the similar lines here, if I could go to page 7. I found this interesting. I could see where marijuana, this is the youth who perceive substance use as moderately or greatly risky. And due to that discussion with legalizing of some of the THC products, I can see where that perception has gone down. Be it right or wrong on that one. The one that really scared me looking at this, though, is the prescription drugs. I was really shocked to see the change from 19 to 22, from 2019 to 2022. What do you have as part of your plan for preventing this going forward, or trying to educate, I'm thinking, on this end?
do you want to speak to that, or?
Sure. I think really it starts with the parents and what they're allowing in their homes and what they're storing in their cabinets. If their kids are seeing them use these substances, not locking them up, not taking them to the drop boxes or just throwing them down the drain, I think that just sends a message that it's okay for you to take these kinds of substances. So really it's educating our parents on making sure they're locking up those substances. And then that really contributes to perception, youth perception. Yeah.
We also have, on the flip side, the variety of different efforts to get the drugs out of the community. There's a lot of prescription medications in our community, and what we're focused here on for the drug-free communities is access. So where are youth going to be able to access these? And often kids start with prescription medication that might be happening to be at their grandmother's house or in their medicine cabinet. So working on the take it to the box, get rid of those old medications. We also distributed couple of thousand of those doTERRA bags, and those are ways that you can safely deactivate medication prior to throwing it in the garbage, so you're not flushing it down the toilet and getting into the environment. We also had a lock it up billboard that really educates parents, keep everything locked up, alcohol, drugs, prescription medications. So, and I think overall there's been a lot more awareness about like the dangers of fentanyl and recognizing the difference between fentanyl and how one pill can kill, and that was another one of our billboards. So trying to increase education to parents. We just purchased a couple of thousand parent education handbooks and are getting those out in the community right now in partnership with the school district as well.
I brought one too, if you want to take a look.
We do have samples.
Great.
Yeah.
So my question kind of goes along with what's not working well, denial by community members that youth substance is a problem. And when I look on page 14, it talks about parents who turn a blind eye, that there really is an issue. So a lot of what you were talking about so far has a common theme, whereas if parents don't consider these either problems that they're not locked up, or if kids view their parents as, you take them, I can take them, and particularly when it comes to what the enactment of what we will probably see happen this year with marijuana and the use of that being now legalized in the state of Minnesota. How do you plan, or what is your true momentum? It seems to be starting with those parents. That if parents don't think that this is an issue, why would the children hear that message loud and clear? They're seeming not to hear that. So what's the actionable item that you have to really get out to, not just like a handbook, but like a community event or some type of a educational program within all of the schools?
Yeah, I can start. So one of the big parts of Drug Free Communities Grant is working with a coalition. So we have our Scott County Prevention Coalition that meets every other month, and it consists of 12 different sectors and more throughout our community. And these are all community leaders like Karen, and from the schools, from faith, from law enforcement, and we all meet and we have an action plan that kind of guides our work. So really it's breaking those silos and bringing everyone together at the table and making sure they're informed of these issues in our community, and then really giving them the knowledge to take that back to their organizations and educate parents and families in their communities. So I think the coalition it really builds upon our work and drives it forward. I don't know, Karen, if you want to say more.
Well, I'll just speak to, as a faith community leader, this is a time where faith communities can participate in prevention and support of those who are suffering from substance use disorder, and to help prevent and help parents in this time. So we at Shepherd of the Lake have a mental health and addiction team we're just sort of getting our footing on getting in front of people. So monthly we've been offering opportunities for our community to come together and talk about those issues. We did have a naloxone training in this fall. This January we're having someone come speak on her addiction and recovery and her way of how she has speaks out to help people, and also someone from Luther Seminary to speak on pastoral care to walk alongside people. But we need to also really work with our CYF team, and we have the gift of having a CYF team that can help and speak to our parents about this. I don't think it should just be a school, just come from our schools. I think it needs to come from our faith communities, and it's really, even if you're a small church, you can have a leader just speak on it, or have these, having like that parental available at church. So that's what we're doing, and I guess I think if we were to do anything, is to gather the leaders, other faith community leaders, to hear about this and how it is that they can help in this area.
I am interested, have you approached any of the other faith communities, knowing that this is something you're just starting, or are you waiting to see what type of momentum and success you have and bring others along, for those, particularly those faith communities that haven't even thought about standing up such a program like
I
you
haven't yet gathered, and that's really, this is kind of helping me to move that. You know, I think COVID just sort of paralyzed everybody in their own communities, so it's kind of moving out, and so this is really helpful, because I do truly believe faith communities can make a difference in this effort.
We have engaged, we have Ibrahim Mohammed from the Muslim community is on our coalition as well, so we have some additional efforts going on. But Cindy, you hit the nail on the head. We need that parent buy-in. And one of the things that we heard during COVID is that parents were at home using side by side with their kids. Now, that's a very difficult phenomenon to intervene. So unless we get parents on board, very difficult to get the kids buy-in as well. The other piece I wanted to point out, if you look on page 11, we have our Community Readiness to Change survey. And back in 2017, I mean, we were in a community where we didn't talk about the substance use of the community. This is an alcohol-friendly, tobacco-friendly community. And marijuana, those are pretty much our drugs of choice in 2017, and don't touch our alcohol was the issue. We did some education and went from it not being mentioned on the resident survey to being one of the top health issues, that people were starting to take ownership of those issues, particularly when it comes to youth. We went from a 1.5, which was in the denial range, to back in 2020 to where we have a big awareness. We do plan to redo this survey this year. I do anticipate that we'll see much more awareness, particularly in relationship to all of the media out there related to the dangers of opioids and overdoses. We've had several overdoses in our community. So I think that unfortunately has raised and elevated the issue to a higher level. You know, we are primary prevention, focusing on marijuana. It is not, it's not opioids, but if you talk, Dr. Wilcox often talks about the people he sees in the jail getting on medicated assisted therapy for opioids. He asks them what their first drug was, what their entryway drug was, and every single time they say marijuana. So this is why we need to get in front of it, reduce that access, ensure that kids aren't using, get the parents on board.
Can we further discuss this slide since we're on this one? So we're currently at 2.89 would be the highest with community ownership. What really is your goal? Is your goal to get to level 9? And what type of time frame are you looking at to achieve?
Yeah, I'm glad you asked that question. Change in the community is very slow. I do not anticipate that our next number is going to be 9. And it's not just public health, it's not just the county. Again, you've heard that it's really a lot of those partners at the table. It has to be deeply embedded into the community. It has to be a paradigm shift. So yes, overall, that would be great. We're at a 9. That means that everybody realizes this is a problem and no one's supporting youth access, and we don't have, John Smith at the liquor store buying alcohol for youth, and those things happen. So the goal is to get as close to a level 9 as possible. That could take 10 years. So any change in the upward direction is a positive change.
I'll just say this is a 5-year grant, so it will end in 2024, but we do have the opportunity to apply for another 5 years of funding. So that's a good opportunity for us in Scott County.
Can any of you talk a little bit about the involvement in schools? Obviously, you know, Jamie, you said that you have provided information and to give out, but do we know what the schools are really doing with youth? One of the things that stuck out to me a little bit, and again, maybe this can be addressed too, is at least 2 of our districts didn't participate in the data in the past couple of years. And any thoughts about that? Is that why that is? So kind of a couple twofold, just a little bit about school involvement and then that those districts that aren't participating at this point.
Yeah, I don't want to speak to why the schools didn't participate. There are some incentives for the schools. They do get ownership of their own data. So they do get, you know, record of their findings. We have to make a request to the state to get anything that would have a district identifier on it. So that is relatively protected data for the schools. Our policy is never to do anything without the district's permission. And in the past, district sharing has required a letter of support from the superintendent for even us to get a copy of the districts in our county. I want to just add one more thing on the data here, that I did go back and pull all the data from the schools that aren't in it this year, so that the samples from 16 and 19 are the same schools that you see. We have it for all 5 schools when they participated, but what you're seeing in front of you is just the data for Shakopee, Prior Lake Savage, and Belle Plaine, right?
And there wasn't a lot of difference once you pulled out that data. So I just want to add, they might not be participating in the student survey, which is unfortunate and is a wealth of data for us, but they are very actively involved in chemical health programs, and we work closely with them on providing services in the schools.
Can you talk a little bit about those services, Lisa, what you guys are doing in the schools?
I also have Tamara Sievertson on the phone. I don't know if she wants to, I was just texting her to see if she wanted to talk. Tamara, did you have anything to add about what you're doing in the schools? I'm not sure if we lost her. We may have lost her. Go ahead.
Okay. Well, I can talk about drug-free communities is really about providing youth prevention, not necessarily services, but we do communicate with the chemical health specialists and like the school resource officers within the schools. I keep them up to date on what's happening as far as youth substance use and what we're seeing. And like I mentioned in the packet, school staff, they have really limited time to work on drug prevention. So any support or technical assistance that I can provide to them, they know that I am here to help them and support them in any way I can as far as prevention activities go. But some of the things that we have done is engage with the CAPS program with Shakopee High School and Prior Lake High School, and that's the Center for Advanced Professional Studies. So I usually get a group of students in the fall and the spring, and they work on different substance use prevention activities. And really, it provides an opportunity for them to talk to their peers about the health effects, risky behaviors, why they choose not to use, what services are available within their school, who they can talk to for peer support, things like that. So they've done like National Drug and Alcohol Facts Week in their schools. They've gone to like basketball games and educated parents that way. They've handed out different like small incentives and like I said, it just provides an opportunity to talk about the issues in their schools and let them know this is a problem.
Belle Plaine is also very involved with, like Dr. Raditz and on a chemical health project in the schools. And Jordan also has a variety of different awareness pieces through their chemical health specialists.
So there were a couple pieces of the data that were seemed a little bit conflicted for me. So if you look on page 6, that looks at the percent of kids will report using within the last 30 days. And generally, except for vaping, those trends appear to go down, right? Like that looks really positive. When I looked then at some of both the tobacco compliance check or the tobacco educate, what is it, 17?
Congratulate and educate.
Congratulate and educate. And the tobacco law enforcement compliance checks, the percentage of passes is going down. And so I wonder what you think about that. If kids are reporting less use within the last 30 days or less frequent use with fewer kids, a smaller percentage of kids are reporting use within the last 30 days, but your sellers are passing those checks less frequently. And what does that mean for your work going forward?
I can comment to some of that. The Sheriff's Office has a program where we do compliance, and we network with the state, and we're starting to network more with the county. But one of the biggest things that we probably need to focus on as professionals is exactly what Carlson said, and that is breaking down the silos. We're very good staying within our own lane and doing our own job, but sometimes we fail to branch out and share certain data or certain information. And a lot of times, because we build such strong silos, we believe that we're inhibited to act in a certain way because of policy or procedures, when it really just comes down to, well, this is just the way we've always done it. And once we realize that, and we can break down those barriers, we can come together with more effort. Now, certain compliance checks, there has been some failures this past year that we haven't seen, but it was directly related to the training that particular establishment may have given or may not have given. And so the Sheriff's Office has stepped up to provide free an opportunity to be trained. So we have server training, and then we also have compliance checks, which also have an element of training. And so let me explain that real quickly. When you have an establishment that has service for tobacco sales or alcohol sales, they can come to one of our sessions. We can train them to make sure that they know what the law is and how to ensure that they're selling to the right person. Now, if we go and do a compliance check and they fail, instead of writing a citation and walking away, if that worked, we'd have no speeders in the world. So what the Sheriff's Office has done is networked with the Attorney's Office in a very positive way. And what that positive direction is, hey, you failed. Let's get your name. This is my name. Here's the report number. This information is going to be referred up to the Attorney's Office. And then what we do is we network with the Attorney's Office to get this person into one of our training courses. We then provide that training to that person, give them the building blocks that they don't have, and in fact invite maybe their business owner or their managers to come along to that training. Mm-hmm. And once that training is completed, we take that case and, for lack of a better term, we trash can it. This past year, we had a person who was greatly affected emotionally because they had failed the check. They were a young server. They were trying to do the right thing. They got the numbers mixed up. And in the past, put a citation, walk away. What have we done? We haven't done anything. She went through, or he went through a course and responded back with an email thanking us for what difference that made for her just emotionally. That's the way we're going to move forward. That's what we as a Sheriff's Office is trying to do. That's what we're trying to do as an Attorney's Office. And quite frankly, that's what we're all talking about right here, right now. We just have to break down those silos and move together. If I could add one more thing to answer a question for Jennifer, and that is, there is a school district that has invited the Sheriff's Office to come and give one portion of their driver's instruction classes. So what you do there is, instead of giving it all to the Sheriff's Office where a big bad guy comes in with a badge, no matter how good looking I am, I'm not going to get everybody to buy into my philosophy. But if the course is set up with a teacher that they already trust or a counselor that they already trust, that builds a little bit momentum. And then if I just am given one section of that, I have an opportunity to make an impact. And I had this opportunity this past year to go and substitute for the sheriff who was out of town. And some people know me from the community because of my family's businesses, because of my children. And so I was able to relate to them. Then I brought some data, some facts, but this was the big positive thing. The school offered extra credit to the child if their parent attended. So you're thinking about the fact of how you're going to change to a 9. It is probably going to take quite a few years because you're actually trying to change a generation of philosophy. And it is interesting that after these courses are done, what children will tell you about their own home environment. Nothing is going to compensate for failure in the home. But let's not focus on the failure. Let's focus on how we can break down those silos and bring a building piece to give a child or even a parent a different thought process when it comes to these items.
Thanks.
The other thing I wanted to add is, if you notice on the congratulate and educate checks, and just to clarify, that's what public health does, and we go with a minor who looks very young, and we do not do enforcement. It's education only, and this year we did see more fails than we've ever had before, but keep in mind, we didn't do it for the previous 2 years. So there has been a gap in those reminders. So the law enforcement goes out, and about 6 months later, we'll go in. When they pass, we give them a thank you for not selling, a pat on the back, it's nice and warm and fuzzy. If they fail, we provide education. So it's another opportunity to go out to touch that entity or that server, and we hand them some information about what the law says and where to get more resources. So it really is just a reminder check, it was very unfortunate that we had so many fails, and I do believe that part of that had to do with COVID.
How's that received, Lisa, when you do that? Can you talk a little bit about that?
Overall, it's really been very positive, especially the ones when they pass. They really like those. Jamie did them recently. I don't know if you want to talk about how the fails have been received.
Well, we did education to retailers on THC moratoriums in the cities that had passed a moratorium. And I guess the ones who had failed didn't really know about any of the laws, were really confused about the city's moratorium. So that just goes to show you how important this education is, and just really that partnership with the retailers. And then also I did want to point out on August 1st, 2020, the Minnesota passed a law raising the age to purchase tobacco products from 18 to 21. So right in COVID, when we weren't doing the checks, is when we passed that big law. So again, just providing that education and making sure retailers know how to check IDs and what to look for is really important.
I think overall they're happy that they're not getting a fine. Right. Like
Sure.
We're not law enforcement, nothing personal. Not law enforcement, and we really do it in a very cooperative manner. And we often, if you have any other additional questions, please feel free to reach out. So it's been positive.
That's great. Thank you.
One of the challenges we talk about all the time in these Scott Delivers is how tough it is if your program is geared primarily to prevention, to be able to measure impact, right? To measure what didn't happen, or to measure whether your program is making the difference that you want it to make. And so when you look at this packet of data, are there one or two pieces that are most important to your coalition or to your internal team that says, like, this is really our strongest evidence that our work is making a difference?
Well, for the DFC grant, we are required to report on 4 core measures, which is in the packet, and that's on youth use, and then perception of peer and parent disapproval, and then perception of how risky they think the substance is. So really, we do take that into consideration when we're looking at our action plan and planning for the next year. I would say those are 4 really important measures. Lisa, did you have?
I think all the data is key. And we have a lot more that we can bring to the table.
I know you do.
You know, it always is tricky and I forgot to bring for Commissioner Beer, the return on investment in primary prevention strategies, but I will get that to you later right after. I think one thing that's really positive, I think the amount of drugs that have been turned in, pounds of drugs collected in the drop boxes has increased over time. I think that shows that people are taking this seriously, that they should not have these medications in the community. And even more so in 2021 and 2022, we distributed another way of getting rid of drugs that aren't being counted, because we sent out a couple thousand of these doTERRA bags. So in addition to them doing this, they're also doing that. So I think that shows that people are hearing the message and understanding. I mean, it's one thing to hear the message. It's how you move from the message to action, and how do you measure that? It's always tricky, but sorry. And it's not just those primary prevention. I think you've seen this graphic before. There's so many different layers in this, that like the bottom line is at this very end, we want to save lives, right? And what are the multiple different steps that the county, the faith-based, the hospital, the community-based entities need to take in order to get to that point of saving lives? We have a lot of partners at the table, and I think that's key, and that is a good measure for us as well, is how many partners do we have that are participating in this. It's not just public health. And the more partners at the table, the more we can get this widespread message. People have to hear the same prevention message 6 to 10 times to make a difference. So,
I'm sorry. I was just going to say, speaking of partners, it looks like Lisa couldn't be here unless she's online, so maybe I can direct a question to Ron, if he's willing. The graph 19 talks about the choose not to use golf tournament. It's been around ever since I've been here at Scott County, and clearly, if you look at that graph, the number of volunteers and participants, as well as substantially the fundraising that has risen over the last, looks like about 15 years. And so I just was hoping maybe somebody, again, Ron, looks like it's you, could talk a little bit about how you use those those dollars, and how those impact some of the work that's being done for drug-free communities.
Certainly. In the past, we had a curriculum to numerous schools throughout Scott County, where we provided the curriculum directly to the schools free of charge, where they would teach the curriculum that we presented to them. And it was a curriculum that was approved by Harvard to educate kids on drugs, and hopefully help keep them making the right choices in life. Now, just this year, we're starting a new program with, again, a new curriculum. If any of you are familiar with Chris Herron, he's a former professional basketball player who went through some very severe, hard times, and he has a program out there with the curriculum to, again, teach kids. So starting this spring, I think we're starting in Jordan, I think it is, that Chris Herron actually comes in and will give a presentation to the kids at an assembly. It's a very powerful presentation. We've seen it and reviewed all the information so far. And then before his presentation, they actually do the curriculum in the classroom. And we're also hoping, and we're planning on having a evening program also for parents. And the Herron Foundation said it's best to have those separately, because they don't want parents in the same assembly as the kids, because it would make the kids less willing to talk about any situations that they might have. So we're hoping to have a community education in the evening, plus for the students during the day. And we're starting that this spring again in Jordan. Right. We're also doing more partnerships with public health recently, with billboards around the county, to, again, hopefully educate parents and kids on drop boxes, on edibles, and how to keep them separate, and just, again, try to make kids make the best choices in life.
Thanks, Ron.
Yeah, no, if you haven't heard you mentioned the fundraiser. This year, we are moving the fundraiser to Legends Golf Course, and we're looking forward to a new partnership with Legends, and again with the new partnership with the Herron Foundation.
I'm going to invite last question before we turn it back to the commissioners.
My question, kind of, it's not included in this data here, but of the kids who choose to use, how many of them are tied to either overdose or suicide? How, do you have any correlation between suicide, teen suicide, death, and the use of either drug or alcohol?
I could look once we get the data. We have very, very sparse data from the Minnesota Student Survey so far. I would be suicidal ideation and not, something that reached a clinical level of attempt or something. But we do have student self-reports in the Minnesota Student Survey that we could look for a correlation between use and suicidal ideation.
I think you should also speak to the harm reduction that's being part of the effort. I think I'll speak from my own personal experience. I have a husband in long-term recovery over 30 years. Our household spoke about addiction their whole lifetime, and it didn't stop them. And a pretty functional home didn't stop them from using when it was illegal. And so how do you then instead, in turn, talk about harm reduction? Because they're going to use anyway. So I think that using Narcan, having Narcan be part of a conversation, if you're going to take a pill, know where that pill is coming from, or that you have Narcan in this in your house. So I think you have some of those efforts going.
Yeah, upcoming with the opioid work plan, there's going to be a big push to get more naloxone in the community for everyone to use, parents, families, schools. We've done some training for naloxone at schools. And some community-based organizations, and Jamie can tell you all the different ones we've done them at, to get more naloxone in the community. We are doing something right now with the jail where everyone who is being discharged is getting naloxone and fentanyl strips so they can test to see if it is fentanyl. So it really is moving towards, if they are going to use, how can they use it safer? So if they do accidentally OD, is there life-saving medication that will bring them back, and different ways ensuring that they're using safely so they're not spreading additional disease in our community as well. So from the youth perspective, we are teaching youth how to use naloxone in case one of their friends or their parents or they're an adult has used and has OD'd. Do you want to talk about any other?
I also want to say, so Tamara has helped funded putting Change to Chill program within schools, and that addresses mental health and really how to cope with like mental health stressors that they're experiencing in schools and in their daily life versus turning to substances. So really looking upstream at those protective factors and how we can work with the students and really support them in their daily life instead of turning to substances.
And I think that's one of the things we're doing at Shepherd is to do the emotional, spiritual part of, where do you turn in these times? Better strategies instead of going to drugs and alcohol.
And the hospital's on board also. We are working with them to also duplicate that anyone who does come in for a substance use related OD, that they're going to be automatically giving out naloxone and fentanyl strips, and we've begun discussion related to a safe syringe program. So just a variety of different areas that are aligned, basically giving the same message and providing different opportunities.
All right, thank you very much.
Mr. Chairman, I'll turn the microphone back to you.
Thank you very much. Board, is there any questions? John, thank you.
I don't know if it's questions or comments, but I guess I'm wondering how your work will change in the environment we're in, where marijuana is likely to be legalized in our state. I walked into a major big box store the other day, and it said, if you use drugs, don't even bother applying because we test for drugs. And this company is one we'd all recognize with the orange colors. And they're a company that's probably across the nation. And I guess I'm wondering, there's federal laws, and there's state laws. Apparently, marijuana is still illegal federally, and I wonder how a company even navigates in this environment where they have trucking and they have business across states and their stores are across states and their employment patterns are, if you're rising the company, you're going to be shifted across states. I mean, it seems like a whole different environment we're entering in. And, in Colorado, they just closed 2 libraries because they had to decontaminate them from meth in the bathrooms. And in Colorado now, Schedule 1, there's a list of Schedule 1 drugs that are the hard ones, cocaine, heroin, and so forth, that now if you have, I think it's 4 grams or less, it's a misdemeanor, which is like, so I guess I'm wondering, I just lay out a few things like that. How is your work going to change in this different environment?
I could say we're going to be a whole lot busier. I think, employment is not really our realm, but I think at that orange store, they can test if they're using heavy equipment. But I think overall, and I would have to, I don't know if Lori Huss is here, I mean, it's definitely something that our county is going to have to figure out related to testing, because I don't believe we'll be able to continue to test for marijuana, although I'm not sure that's affirmed, because you could use it 2 weeks ago and you could still test positive, but are you really under the influence? So there's a lot to be figured out on that level. The Drug-Free Communities program is we're not anti-marijuana, because I would agree with you 100%. In the next couple of years, it's going to be legal across the board in the state. That's where we're headed. But we are youth access. We're really focused on youth, and we want to make sure that kids aren't, because it's an adult product. The same with alcohol. We're not anti-alcohol. We just want to make sure that youth are making good decisions, and adults also aren't drinking and driving and things like that. So really, we'll do more focused efforts related to marijuana. But as you can see, even in that chart with youth perception, the drop in use 2 times a week has dramatically dropped. So that message is already out there. It wasn't even legal yet when they took the survey, and they're already thinking, it gives that impression that it's a safe product because it's legal now once you turn 21. And so we need to do more messaging, more education about the developing brain and what marijuana could do to the brain while still developing. There's a lot to be done in that respect. And the statute does include information about messaging to pregnant moms and messaging to youth. There's just not a lot of dollars for local public health yet in there. So it's an unfunded yet another unfunded mandate, and we will see the trickle effect. We will definitely see the trickle down related to increased use, increased poisonings, et cetera, et cetera, et cetera. It's a floodgate of what could happen. So we're hoping to get in front of it and start messaging now and getting that education on board and working to make sure that youth just don't have access. I think another giant burden is going to fall on law enforcement. And if you want to speak to those.
I guess that's a segue for me to
That is.
respond. Like I said before, basically what you're saying is we already have products out there that we're concerned about that have been legal for eons of years. We're now adding another product, and so your ratios are just going to go up of who's going to be using it and who has access to it. From a law enforcement standpoint, we're law enforcement. I can't go out and enact a law that is the law of Dvořák. I can't. We're mandated to follow the law. So as the law changes and we see the ramifications from that law that might be negative, is why we're sitting here talking about it today. And so do we have a magic wand that's going to make this go away? No. You gave an example of another state, okay? Researchers knew before those laws were passed what was going to happen. They knew it. People in the state know it. I think it's going to come down to more of the smaller communities, counties and such that come up with ideas that work that might be able to show the best way forward. And the only way we can do that is having these meetings, breaking down these silos and saying, this is what works good for our community. And we come together as a team and we follow the law and we intervene where we can. But it's not going to be easy. It's not easy now, but we don't need to get negative about it. We just need to be positive.
Okay, any other questions or comments? Commissioner Brennan?
I have a question and I have a comment. My question is regarding the people in our community that are not usually represented. Being out in the community recently, I talked to different Somali group or the Latin group, Latino group, and there was a concern with the Somali group about the parents of children in denial that their children were actually using drugs. So are you working at all with those communities to hear what they have to say?
Yeah. So we have engaged with Advocates for Thriving Communities right here in Shakopee to provide a naloxone training and do some education to moms on opioids. And so we hope to continue that relationship. We've done some education with Esperanza as well, which is Latinx, some of the Latinx community within Scott County. So just continuing those partnerships, I think, is really important. Did you want to talk about the community presentations, conversations?
Oh, actually, yeah. We recently wrote a health equity grant that engaged both the Somali and the Latinx community for substance use. One of the targets is to reduce denial and lack of awareness in the Somali community. And we are working with Sarah Odawa, who's now an employee of ours, who started Advocates for Thriving Communities. And part of that, within that, we have included conducting community conversations with the faith leaders in that community to help them get on board, and so they're saying the same message. For this grant, the Latinx target was really the mental health and suicide prevention, because there has been quite a bit of those issues in that community, and that was the priority for them at this time. But we will also be including community conversations with them as well. We do have a current effort going on in the Latinx community where they are bringing up, are including topics in small group discussions and a couple of large group discussions related to opioids and substance abuse prevention. So we have been working with those communities, and we have several representatives on our coalition that are part of the BIPOC population.
Okay, thank you. I do have one other comment. I was recently on the Shakopee City Council, and we passed the vaping ordinance for flavored vaping, and we also passed the THC ordinance. And when I was making those decisions, I had more calls regarding flavored vaping from the national organizations to vote against flavored vaping, and then very few calls regarding people who are against the sale of THC products. So when you're talking about on the charts, the perception of those substances, I think that's very real. I mean, if we're making policies based on information that we're getting, it's very difficult to get a clear view of what it is. So I don't know. I don't have a question regarding that. It's just an observation that I have. Okay.
Thank you. Any other questions or comments? Anybody? Okay. With that, thank you very much. Very nice. So, yeah, thank you for everybody on the panel.